Dr. Kate Sellan is an assistant professor in the Faculty of Design at OCAD University, working on interaction design and innovation in healthcare. She leads the Healthcare and Resilient Experience Research Group and the Envision Health Group at OCAD. She is also the director of the Health Design Master's Program. She works on bringing an interdisciplinary approach to healthcare challenges by combining design thinking and design practice with theories and knowledge from information systems, human factors, and health-related disciplines. Her presentation is entitled Role of Design in Synthesizing Different Kinds of Truth About Health and Well-Being.
Thank you, Simon. Thanks for the opportunity to speak today. Who's interested in truth these days? So when I put this abstract together, we weren't in quite the same political situation as we are today. But I think it has relevancy, certainly beyond the health and well-being, what I'm going to talk about today. And really what I'm asking for people in the room to do is consider the concept of truth and how we work with it in health, and how we work with it as designers too. So I came to this topic because what I found in my teaching and practice is that I was struggling to avoid the kind of ways in which we tell the story about disciplinary silos. So explaining to students why change in healthcare is difficult, why it takes so long, why integrating with the medical professional in a design project might be challenging for them. And I wanted to get away from that sort of generalization and actually think at a meta level about what's actually going on when we deal with different kinds of understandings, different ways in which we view knowledge and information. And so I looked at some of the work of Lorna Weir, who wrote an article in Canadian Sociology quite some time ago now. It's quite a difficult read. But what I got from that was a sort of a philosophical view of different lenses or different flavors of truth. And I'm just going to talk about three of them here: symbolic life truth, sometimes called mundane or everyday truth, and scientific truth. So the most familiar one is probably scientific truth. We have all kinds of, shall we say, ideas about what that is. It's sometimes sort of the faceless science. And I think that was reflected in Robbie's quote that he provided on cystic fibrosis, the kind of faceless scientific data that we use to sort of put a boundary around something like a diagnosis. And then we have symbolic, which is somewhat close to religious with a small r, and we'll get into that a little bit later. In terms of how we might talk about well-being, some examples of how this plays out are things like when we talk about life or mundane, everyday experience, what is the mundane or everyday experience of well-being? Often we talk about patient experience in terms of illness too, so what is the experience of illness on an everyday experience? In terms of symbolic though, often these are our leaders, and when we know that we're dealing with symbolic truth, it's because it's delivered through ritual. So in fact, what I'm doing today is a kind of symbolic truth. I'm up here in a kind of ritualized activity, delivering truth about design and health. One could be a patient advocate, or somebody who is representative of lived experience, who does this kind of thing on a regular basis, and they have symbolic knowledge. There is truth in what they say because they deliver it through ritual, and they have a particular role to play in telling their story. And with that comes a certain kind of legitimacy, right? There are certain things that count as truthful if you are operating with symbolic truth. Is it truthful because you have an MD at the end of your name? Is it truthful because you are hailing from the Mayo Clinic? Is it truthful because you are a patient advocate who has been speaking on this issue for years? So these are the kinds of things that I tell my students to look out for, because they really help us to orientate our thinking around who we're working with and how truth is operating in the problem space that we might be trying to solve for. I would say that scientific truth is often overlooked. We often regard it as somehow in the environment of medicine. But in fact, real scientific truth, the kind of truth that comes from scientific procedure, is often hidden, or it's retold in a way that is symbolic. So an example of this would be the facts about cystic fibrosis told by the world leader in cystic fibrosis research, right? It's an interpretation. It may not be core science. So play with that a little bit, because that's actually sometimes difficult to distinguish between those two different types of truth. Why this has importance for the design process is because it impacts how we might integrate different stakeholders in the process that we have, how we might integrate different kinds of information, and ultimately how we talk about our outcomes and how we synthesize that truth together to create an output. And as designers, we have our own truth regime, right? We put the prototype, that final prototype, as being the recognition that our project has truth in it. That prototype holds symbolic truth. It's the combination of everything we've done, and the project doesn't really get realized until we have that final prototype. So we have our own versions of these types of things. In terms of well-being, scientific truth often plays out in certain venues, as I mentioned. There's often places where you have to go to for this information. And certainly if you're working on certain kinds of design projects, interfacing with the evidence base, or the so-called evidence base, is one way in which you can recognize how scientific truth comes into play. But it comes into play in other ways. So negotiating who gets to do this kind of work in a design process. If you're working on a multidisciplinary team, is it the design team that does this kind of truth-seeking? Or is it the medical specialist on your team that does this kind of truth-seeking? Or what kind of alternative perspective might you get on the information that you could glean from the evidence base if a designer is doing this, or a designer is doing it in conjunction with a data scientist? So asking those kinds of questions, I think, helps us to think of new ways in which we can integrate this kind of truth into design. Symbolic truth is all around us in terms of well-being. So we have, what would Dr. Phil say? In the same way that in design we have symbolic leaders who we ask the question of, what would Johnny Ives do? We have, what would Dr. Phil say? What does Oprah think about this? We have certain figures who play very key roles in deciding what is truth about an issue, or what they would suggest is truth about an issue. But we also have other kinds of ways in which this plays out. I mentioned the Mayo Clinic. The Mayo Clinic provides scientific truth, but it may also provide symbolic truth. It stands in for a kind of leader in what it does. And so we regard it in a kind of symbolic way. We also have the issue to deal with when we design for well-being around alternative medicine. So I put the Nature's World's Best Cancer Clinic up there because it was recently in the news. Oftentimes, something like the baking soda cancer treatment or the anti-vaccine rhetoric takes on a sort of almost religious symbolic style, right? And it does so in the way it treats truth, who gets to talk about it, and also in the way that people design around it. So if you look actually at this clinic, you go through you walk across a stepping stone of a moat into the clinic. So even the environmental design of the clinic itself is referencing ideas about transformation and knowledge change as you move into the clinic. It's a kind of leaving behind your truth and taking on a new kind of truth. And these are the things that I really think we need to pay attention to. Because if we're dealing with designing for areas of health and well-being that contain symbolic truth, we need to be aware of how powerful it is and how it operates. Symbolic truth can also operate at quite micro levels. So on our design teams, we have We maybe have a physician who plays a symbolic role. They get to say things maybe other people don't. When the physician is not in the room, the nursing leader gets to say things that maybe other people don't. Someone may disagree. We also have specific design roles that get to say things, and they hold truth. Let's be honest. We have specific people in our community who get to say things about design that others don't. So we also have symbolic truth operating among us. What's really exciting, and why I really enjoyed Robbie's talk, was the importance of understanding mundane, everyday truth, the lived experience of being, of living with a chronic disease, or of experiencing a healthcare situation, of that struggle to health seek or to maintain well-being that many of us experience in different ways throughout our journey through life. What we're starting to see, which is very exciting, is not just the integration of patient experience into design and patient involvement directly in design, people with lived experience in it who are in advocacy roles, but we're also seeing an acknowledgement of spaces, places, and rituals, or ways in which patient lived experience truth is shared. So we now can look to Twitter for truth around the patient experience. We can, in fact, you can see here on the right-hand side, the diabetes Twitter account recommendations. So healthcare organizations are in fact looking at these sources to recommend places or Twitter accounts to follow that can be a supportive aspect of care or informing for their own clinicians themselves. Patients Like Me is a fabulous example of this, where you have a combination of the scientific truth and the symbolic truth of the patient experience and the mundane and the everyday all in one place. And I think we're going to see more and more the opportunities that this has for design. So back to some sort of practicalities. Let's not be afraid of the evidence base. As designers, we like to deal with sketches, we like to deal with hands-on stuff, we like to be there with the stakeholders running workshops. But sometimes perhaps we should be stepping back and we should be actually engaging with the evidence base ourselves, making room for science in our design, particularly in the area of well-being and health. This may be a really important thing to do as we continue in our post-truth world. This is some work that we're doing with St. Michael's Hospital. We're designing a first aid toolkit for a fentanyl overdose. And we're engaging in the evidence base around stigma, the evidence base around naloxone, the evidence base around the lived experience of overdose. And that's a key piece of our design process. We're not going to leave that to the side. We're actually going to bring that in every piece of our process, as well as engaging directly with community members, and we're working directly on our team with community partners. Synthesizing the narrative with evidence. One of the real challenges here is how do you make that balancing act? How do you balance the scientific evidence, the narrative, the stories, the really rich, empathetic experiences that get told into something that you can actually action in the design process? A really tricky thing to do. So pushing the boundaries on the kind of techniques and tools we use to do that, I think that's where we really need to be sharing stories among us, is how we actually do that. And kudos to the Moment for their work with the Mohawk Valley. Superb work. Interestingly, in that work, the idea of the falls, to be able to tell a story about the actual number of fall reductions has symbolic value. It may seem within the design community that that's just a data point, but for the healthcare community, to be able to tell that story and have that piece of data is a symbolic act. It's a way in which you give back to that community a piece of data from your work, but you're also saying, I acknowledge the importance of this piece of data, right? You're respecting the truth regime. So what we try to do always in our work is to think about how we actually communicate in our design process, how we communicate with all our stakeholders, so that we're taking account of their truth regime and how we do that. And if we don't mention, say, if we're doing a project on falls, we're not going to not talk about full numbers. That needs to be in there, because if it's not, then one of our stakeholders might be wondering, well, what about this outcome measure? Why has the outcome measure disappeared from the design team? And that would actually not necessarily be respectful. We'd want to keep those pieces of information and truth present, so that all of the truth regimes at the table know that the project is moving in the right direction. So this project is a wonderful collaboration. Karen Oikinen, who's sitting in the front here, brought this project to us with St. Elizabeth Healthcare. And I just wanted to give you a vignette of how this works in practice, a very small, tiny moment in the design team. We were having a meeting, we were looking at synthesizing all these different narratives across co-design experience maps, and there came a point where we had to decide, do we express, is there a value in providing two narratives to death? One where hospice care lengthens life, maybe by even 1 or 2 weeks, who knows? Or maybe where the choice not to choose hospice might lessen the length of life. And that moment was a moment for evidence, right? There is an opportunity where you can say, well, what does the evidence base say? And as designers, we don't necessarily do that. We might make a compelling story, but we need to really fact check that. So this this last one is an example from some of our student work. So this is some of the students from our new health design program. This is Laura Halloran, and she's presenting on the doffing and donning of personal protection equipment. And so what this, I think, really demonstrated for me was that integration of designerly ways of knowing, the prototyping, the iterativeness, the getting from sort of sketch to final prototype, and the testing of that prototype with the integration of evidence. So we worked with UHN Human Factors on this project. It was really a fun and super experience for everybody. So this is where I want to end, by just providing you with this diagram for you again to just think about this. Sometimes it's a little bit tricky to sort out in our heads what these different kind of truths are. So I'm going to leave this with you a little bit to think about. But I think what the main message I'm trying to get across here is that what I found super helpful about looking for different kinds of truth was that it only helped me understand what I do as a designer and the kinds of artifacts I produce and why I produce them and who I share them with, but also it helped me understand the partners that I'm working with on these projects, the different kinds of artifacts that matter to them, the different styles of communication, and what truth counts and who gets to tell that truth. So thank you.